خلصتي سوالف؟ لا خلصتوا؟ طيب السلام عليكم جميعا. اليوم العدد اكثر، مش عارف شو يعني. بتسجلوا زياده بتروحوا على رئيس القسم من تحت في معكم واسطات ولا شو قصتكم؟ قديش العدد عندي والله ما بعرف الشغله، بجوز فوق ال 100 110 او 111 بتستوعب القاعه، لكن شايف ستيل يعني كراودي ليتل. طيب سامعيني الشباب اللي بالخلف؟ صبيه اللي بالابيض، ليش قاعده وراكتي هي؟ لاقي لك كرسي قدام. اللي بالخلف ها؟ طيب رجال يعني اللي بالخلف اذا بسمع صوت انا بدي اسف انا اقول لك جود باي، اقول لك اطلع ماشي، لانه بتعيق يعني على او بتاثر على زملائك الثانيين. طيب last time او last lecture يعني we talked a little bit يعني عن اشياء لها علاقه في الانتي مايكروبيال regimens in general. Do you speak Arabic? Okay, English. So I will continue all the lecture. Huh? Since we have one or two students, they speak only English. So we will proceed or continue our lecture with English. Okay? طيب اعطوني المايك اللي بسامع. اوكي I will make طيب انت اللي بتسامع تعالي قدام، تعالي على رقم 4. تعالي على رقم 4. اوكي تعال. هاي انا مش عارف اصلا وين موقف القاعات لانه كل شيء مغلق، ما في مايك. بس انا شايف المايك، شوف المايك. طيب anyway again and again for those who didn't attend last lecture, أنا دكتور أحمد عزيز. Okay, I will be with you inshallah for this section, the whole semester. Okay, the other professor who gonna teach with me اللي هي دكتور مياو عبابني. Okay, he's course coordinator for this course اللي هي infectious disease inshallah. Assessment, last time we talked about the assessment, we will have first, second, final, as well as we have like 5 points for active learning, okay, stuff. I will decide later what's going to be like a report, assignment, etc. Okay, so leave it later for the next couple of weeks. We started last time just like introductory, we talked about the antimicrobial in general. What do we mean by blah blah blah? بعض المصطلحات, some terms, etc. Okay. Inshallah, we will continue most of the lecture today. Okay. By the way, this Wednesday I will not be here. Okay, I will be inshallah outside the country attending conference. So I will just post the remaining of these lectures online, okay? Maybe 10 or 15 slides. the remaining 15 slides, okay, will be recorded and posted online on the e-learning system. Starting from next week, يعني إن شاء الله we will get more خلينا نقول we will go through deep or more deep details. Okay. طيب خليني بس أنا لأنه مش عارف إذا صوتي مسموع ولا لا. هذا معه مفتاح شيء something to. Can you hear? منين جبتوا المايك؟ وين المواقف؟ اوكي هناك طيب ماشي. I will keep holding this. طيب can you hear me now? Better? All right. Okay, we don't wanna يعني lose more time, guys. Inshallah, as I said, this Wednesday you will have no lecture. Okay, and it will be pre-recorded, and I will post it for you online. Or if you have any questions, just let me know by next week, okay? We didn't start the real work yet, okay? Topics for the first exam will be this lecture, the upper respiratory tract infection, and as well as lower respiratory tract infection. We will have like 3 topics, okay? Later on, we will continue with the meningitis, sepsis, surgical prophylaxis, antifungal, etc. for the second and the final exam. I think Dr. Mira is supposed to like post the syllabus online, right? Did you see it online or not yet? 40 بعد ايش يعني انت بتاخر؟ يا شباب رجال التأخير ممنوع يعني صراحة اليوم تأخرت 3-4 دقائق بس عارف انه في ناس بتتأخر أكثر من هيك. وانا I allow you guys just like 5 minutes, okay? يعني ممكن تتأخر up to 5 minutes. Anyway, طيب, as we talked the last time, when we talk about like antibiotics, what do you mean by antibiotics? Antibacterial. Antibiotics, antibacterial agent, not antifungal, not antiprotozoal, not antiviral, okay? Antibiotics, synonym for what? Antibacterial agent. You're supposed to cover like these topics in pharmacology 3. Mechanisms of action, cell wall inhibitor, like what do you mean by glycopeptides, okay? How the microlides, for example, work, mechanism of action, kinetic, whether bacteriostatic, bactericidal. You're supposed to know this information from the previous courses, صح? Microbiology and pharmacology 3. Okay? In this course, what is the aim? To know the treatment of choice. What is the alternative treatment for such infectious condition? For example, otitis media. If we have, like for example, kids, adult, elderly, pregnancy, okay, special populations, what is the treatment of choice? What is the dose? What is the regimen? Okay, how you go and proceed with the management for such patient if they have 1, 2, 3, for example, complication, etc. Okay, so we will not talk that much about the mechanism of action or, for example, detailed pharmacokinetic or dynamic, unless we need it for the purpose of this course. Okay? لأنه مفروض بتعرفوهم، جيتوني بتعرفوهم. Okay. So simply speaking, choosing an antimicrobial agent to treat an infection is far more complicated than matching a drug to a known or suspected pathogen. What do you mean by this? Okay? What do you mean by this? For example, if you went, like for example, to the hospital and they found that you have a pneumonia, okay? Now, okay, they will start like treating you with common antibiotic if they are suspecting like bacterial infection, right? Sometimes it might be viral infection followed by bacterial infection, like COVID-19, for example. You're supposed not to give antibiotics, right? So sometimes the decision is not that easy for the physician or the doctor, because you don't want to give antibiotic and at the end of the day you found that it's not working, or the bacteria is highly resistant for such a drug, and it went for waste, money, time, or more complication for the patient, right? بالتالي, like to pick the treatment of choice is not an easy option always. Okay, we have simple infection that you can give antibiotic and tell the patient you can just go, inshallah, and you should feel better within 5 to 7 days if it's a simple infection. If you go to a dentist nowadays, okay, what they will prescribe you? Okay, if you have, for example, inflammatory gum or gingivitis, for example, he will tell you, okay, you have inflammation. Till we treat this inflammation, I cannot do any procedures like tooth extraction or any surgery, etc. He directly will prescribe you what? Amoxicillin or augmentin, amoxicillin clavulanic acid, right? Okay, but most of the time, this drug doesn't work. Why? Because we have high level of resistance, and from population to another population, actually, it is totally different. You know, here in Jordan, we used to give antibiotic for these children. You go to pharmacy, you pick any antibiotic you want, and you buy it like you are buying, for example, bread or something else. Right? In these countries where you have more restrictions, okay, maybe the antibiotic resistance is less. Actually, why they put more strict regulation nowadays for antibiotic prescribing? It should be only prescribed for a specific indication. It should be written by well-qualified physician, etc. Okay, why? Because the high level of resistance we are seeing nowadays among antibiotics, different antibacterial agents. Okay, in the future, if they didn't develop a new antibiotics, for example, you will face a problem of what? None of these antibacterial agents will work even for a simple infection. What does that mean? The end. Okay? يعني أي infection بسيط. I will explain some points in Arabic. Okay? يعني ممكن infection بسيط يبتلك. As simple as that. صح? نرجع, we go back like 1950s, 1960s. Okay? When they discovered the penicillin for the first time. Okay? By Alexander Fleming. طيب. Pathophysiology. Of course, you need to keep the normal flora intact. Don't touch. Okay? Normal flora, actually, they do exist in your body. Right? في عندك bacteria نافعة بسميها in Arabic. So normal flora, you don't need to touch. In the colon, in the skin, on the skin, etc. In the cavity, etc. Okay? But you need to treat only the bacteria that cause pathogenesis or cause the disease. Okay? But sometimes, while you are treating the condition or the infection, let's say, for example, you are suspecting gastric infection or colorectal infection or intestinal infection, etc. You start to give like some antibiotic or other type of infection. You give antibiotic orally by mouth, right? Or even by IV. Okay? These antibiotics are strong enough sometimes to kill the endogenous normal flora. What will happen later?
Opportunistic.
Another infection will take the place, okay? Another infection will take the place. Another bacteria will come to the scene, all right? And cause, for example, symptom. Like the most common example, which is what? C. difficile bacteria. C. difficile bacteria, Clostridium difficile bacteria, right? Clostridium difficile bacteria is spore-forming bacteria. Really bad bacteria. It happens or associated mainly due to what? The consumption or taking اللي هي strong antibiotic most of the time. What are the antibiotics associated with C. difficile?
Clindamycin.
Clindamycin. Fluoroquinolones. شو الفلوركينولون? What do you mean by fluoroquinolones? Or give me like example on fluoroquinolones.
Ciprofloxacin, levofloxacin.
Exactly, ciprofloxacin, levofloxacin, leutiranek. Okay, what else? في عندنا another fluoroquinolones, do you think? Just look at it. طيب, other antibiotics that can lead to C. difficile also. شو بتتوقعوا؟ Yep. Okay. ممكن sometimes macrolides, cephalosporin, etc. or penicillin in general. Okay. طيب. Clindamycin is highly associated with C. difficile bacteria. But why I'm talking about C. difficile to tell you that sometimes you get some kind of replacement for the normal flora and you develop more opportunistic infection. By the way, management of C. difficile is not that easy because it leads to what we call pseudomembranous colitis, severe diarrhea. Okay, who's changing the bed sheets even for the patient should take care because he might transfer such bacteria to himself or to his family or to his friend, etc. يعني highly contagious situation by the way. ماشي؟ طيب, exogenously acquired bacterial infection. Sometimes you get bacteria from the hospital. Okay. For example, you stay in the hospital for minor surgery, end up like having like severe infection. Why? Because of the infection control unit is not working well there in the hospital. Some hospital, they are colonized, يعني بتكون colonized by specific bacteria. Pseudomonas aeruginosa, strong Pseudomonas aeruginosa. Why? Because this patient will get antibiotic, develop some sort of resistance, will keep the bacteria inside the hospital. Later on, another patient. يعني جو شوي ممكن يكون مش يكون موضوع بس colonized with bacteria. Some ventilators. Why some people they actually die of after using ventilator for a long time because of the colonized bacteria in these ventilators. Okay, أجهزة التنفس الاصطناعي. طبعا مرات انت not because like تقصير خلينا نقول يعني من hospital, but because the hospital they have such resistant bacteria for it happened actually in the all hospital in the world. Okay, but the better infection control you have, the less infection or hospital acquired infection you should have. Okay, طبعا هذا لازم علم. طيب, contrasting bacterial virulence and resistance. What do you mean by bacterial virulence and resistance? Virulence اللي هي severity of the pathogenesis, severity of the disease that could be caused by such bacteria. While resistance means that such bacteria actually is resistance for antibiotic. مقاومة للمضادات الحيوية. Sometimes we can say highly resistance, intermediate. Highly resistance mean what? Actually, none of these antibacterial, common antibacterial might work on such bacteria. Okay? ما في علاج. No treatment. Because no even single antibacterial agent could work on such bacteria. وهي سميناها what we call last time. PAN or PDR, like PAN drug resistance. We have extensive drug resistance وفي عنا multi drug resistance, etc. وفي عنا as well as we have sensitive bacteria. Okay? I'm expecting you guys and on the next time, next lecture, you bring the slides with you. Okay? Don't look at me just like same slides, of course, and don't depend on the record because sometimes you can't hear the voice well. It's better just to write on the slide the extra information I give. بعدهم مش نازلين؟ طيب أنا بعتمد على الدكتور ريان بس أنا بدي أنزل الشغلة مش مشكلة. أنا لأن في تعديلات I have some changes on the slides. Okay. But because يعني I was called shortly to give this course, okay, I didn't get the chance to prepare for such course, okay. But anyway, don't worry. Like I taught like more than 45 courses in my whole journey. It's 7 years. تبعت التدريس درست أكثر من 45 كورس. وبالتالي ما عنديش مشكلة ولا في المساحة. Okay? طيب, clinical representation for infection شو تتوقع? You depend on history, you depend on signs, symptoms, right? Vital signs, right? Lab, okay? أعطوني anything that can tell that somebody has an infection or having infection. Fever, not always, right? Infection, yeah, fever. Might be due to autoimmune disease, for example. Okay? Fever, صح? Yeah, it's not necessarily, it's infection, but it can tell.
Respiratory tract, mucus, respiratory tract.
Okay, maybe you have COPD, not infection.
اللاب تيست يكون في ارتفاع بالوايت
Lab test. Your colleague is saying that lab test. شو lab test?
تزيد خلايا الدم
الوايت بيسيز elevation.
or ECR.
ESR. White BC's elevation. Sometimes we have like differential diagnosis. Not always elevated white BC's tell you that age you have infection. Okay? صح? But normal white BC's from 4,000, 4,500 cell up to 11. صح? But sometimes slight elevation, if you go to physician, for example, pregnant women, they would tell her, okay, up to 15, this is normal. Even it's a little bit elevated. Okay, but this is normal. But if you have really elevated white BCs, it can tell you that this patient really or might really have a severe infection or infection. Okay? But what other condition that can elevate the white BCs? خلايا الدم البيضاء. الصبي اللي بالنظارات اللي صافن هيك. Okay? شو ال other condition that could elevate white BCs? انت طبيبه او دكتوره صيدلانيه يلا تتخرجي تكوني من الاوائل يجوك يقالوا لك اجى قرابتك قال لك هاي الوايت بيسيز مرتفعه يا دكتوره شو السبب؟ ضحكت انت عاد اعطيتيه فتوى فضيت علاج طريقه ثانيه شو بتتوقعي؟ لوكيميا or bone marrow disease صح؟ If you have more than 100,000 for example فوق ال 100,000 severe infection up to 50,000 okay autoimmune disease sometimes could elevate white disease okay as well as other conditions okay what else ESR your خلينا نقول زميلتكم هون she's mentioned ESR what stand for what ESR
Erythrocyte sedimentation rate.
طيب حلو. Why ESR could be elevated? By the way, it is non-specific inflammatory marker. Okay, non-specific inflammatory marker, as well as active protein. This is non-specific inflammatory marker. Keep in mind. ESR. Why ESR get elevated in infection? احنا بنعرف. It could. Sedimentation rate will go higher in infection. Why? شو الميكانيزم؟ وين اخذتوا هالاي اس ار؟
أكثر من مسار.
طيب المفروض تعرفوا شو خلينا نقول I will speak now because then I will continue. شو الميكانيزم؟ شو الآلية عمل الاي اس ار؟ او ليش الاي اس ار اذا زاد اوكي معناته في عندنا انفكشن او inflammation. Why once you have elevated ESR that means that you have inflammation or infection. What is the mechanism? How you can interpret يعني how they came up with this idea. هذا القصد. هسه بيهمكوش حتقول لي شو بيهمني انا بيهمني اشوف الاي اس ار مرتفع ولا لا. بيهمني كمان انك تعرف الاشي واصله صح؟ خلي عندك فضول يا اخي. شو رايك؟ Once you have elevated ESR, that's mean according to the gravity, the erythrocyte will sediment or will go down very quickly, right? Okay, according to the gravity, right? If it goes very quickly, what does that mean? Is it heavier? Huh? Is it heavier ولا lighter? يعني إذا مشت لسرعة heavier. Why is heavier?
فيها يكون قسم ثاني محمد.
Because the inflammation cause clumping of these RBCs together بنزلهم بسرعة.
كذا انه صار في انفكشن فبيجي الخالع وبصير يطلع كميات كبيره من الوايت بلاد سيلز.
Absolutely, but we say erythrocyte sedimentation rate. We are talking specifically about RBCs. أنت لأنه I know what you are saying. زميلتكم بتحكي since we have another cells like white BCs, other inflammatory cells, okay, they will get heavier because they accumulate there and get heavier. Okay, this is part of the truth, but because they also the RBCs get accumulated and they clump so they can sediment or settle easily. واضح؟ طيب radiography زي أيام الكوفيد like COVID-19. تفضل يا شيخ. شو المحاضرة اللي وياها؟ لا هاي صيدلة. طيب radiography COVID-19 you went to the hospital حدا صاب كوفيد؟ ها؟ هيك تستحوش انا صار لي كوفيد في المستشفى. anybody developed COVID؟ ولا صابها هو في حدا ما صابوش كوفيد؟ اوكي؟ قال فلونزا بقى انا فلونزا. والله فلونزا. اوكي؟ COVID the first things if you have dyspnea and you don't feel comfortable, they will send you to radiography, صح? CT scan or X-ray. X-ray, CT scan, etc. But CT scan will give more classification, will tell you more about your condition, right? X-ray will see if you have a pneumonia infiltration, you can see like white patches في البيزمنت تاع ايش؟ اللنج صح؟ في قاعدة اللنج أو الأبكس تبعت اللنج تحت. اوكي كان في وايت كلر صح؟ fluid accumulation white pieces معناته we have infection we have inflammation. radiography X-ray صح؟ طيب what else? For example if you have UTI you will do what? Away from the signs and symptoms lab test for urine analysis. Urine analysis بالإضافة in addition to the symptoms and signs and symptoms, okay? As well as urine culture sometimes before you start any antibiotic. If you start, for example, antibiotic for 3 days, then you went for the physician and ask him to do you like, for example, sensitivity test. It might be like false what? Negative.
results.
False negative. That means the test didn't show any bacteria, but actually it does exist.
كم الفترة دكتور لازم يعني يوقفوا المريض الدواء قبل ما يعمل؟
It depends on the antibiotic kinetic itself. Okay? Okay, up to 3 to 7 days. Okay? بس لازم ما بنعمل كلتشر دائما إذا صار إذا الواحد أخذ antibiotic. It could يعني help, but your result might be not correct. And sometimes, for example, for example, for the male, they have a prostatitis, for example, inflammation in the prostatic gland, okay, due to infection, urine analysis will not show anything. They have to go deep in the prostatic fluid, take part of the prostatic fluid or the sperm, and they should analyze it or test it for bacterial infection. صح؟ تكون أمور أعمق شوي أمور deep. طيب, anyway, fever. Not always telling you that you have infection, but it could be really a leading sign. What is the normal temperature? Orally. طبعا it depends whether you take it orally, rectally, from the armpit, from the ears for children, etc. Okay? Orally, according يعني طبعا definition for all more than 38.3 Celsius. 38.3. But sometimes if you have like for example temperature above 37.7 it will be like alarm sign. مظبوط؟ 37.8 etc. حتى كانت الفحوصات هاي اللي يعملوا لك وياها على اللي هي الوايرلس اوكي they يعني fix the point up to 37.6 37.7 above than that okay you are suspected to have a fever you cannot enter the facility during COVID-19 أنا بحكي جننونا فيها أنا الواحد يدعي بس يجي إنه ما يكونش نازلة okay طيب cause of fever as we mentioned infection collagen vascular disorder autoimmune disease malignancy like cancer drugs induced fever thromboembolism اللي هي DVTs or pulmonary embolism as well as like other causes for fever. طيب laboratory abnormalities the normal white pieces count حكينا 4,500 up to 11 above than that slight elevation it will not make you worry shouldn't make you worry but high elevation or obvious elevation should you have to think twice. Infection stress Inflammatory condition again, rheumatoid arthritis, leukemia, medications such as corticosteroids. طبعا differential diagnosis, when you go for example lab and do like CBC, complete blood count, you will have the white BCs count, and you have a breakdown, how much neutrophil, basophil, eosinophil, etc. Each one should have like normal range. If you have elevation in neutrophil, it could give you indication for 1, 2, 3, 4, lymphocyte elevation, etc. basophil, eosinophil. Okay, كل واحدة it will give you يعني indication for such condition. The white BCs count could be normal, but the patient will still be infected. Immune compromised patient with elderly patient. The geriatric patient, they still have white BCs with a normal range, but could have like infection. ليش؟ لأنه مناعتهم أضعف. Because the immune system is not working well like during the youth. Okay? هاي geriatric problems يعني برجع الواحد مناعته بتضعف، جسمه بضعف، كل شيء بضعف. هو aging. Okay, سنة حياة. What happens if the white BCs count is down 4,500? معناته we have neutropenia. The patient might be subjected to what? Kind of infection also. Okay? Because this is like a defensive mechanism, the white BCs. متى بتحصل؟ When it does happen. شو هذا؟ ها؟ لا لا في شيء صوته زعج. حدا من تلفوناته؟ تلفون. كمان؟ لأنه زي صرصور الليل هذا. جننا هذا هو واحد؟ إذا طلع أي عدو يدفع عليه يعني بوكلك بالمهمة بعد إذنك. ليش تحس زي من الشجر هذا صرصور الليل هذا بس بطلع بالنهار ما بعرف بعد إنه شكله تغير نظامه البيولوجي. مليح اللي بعدهم عايشين هذا. طيب. Absolute neutrophil count, by the way, you will hear it a lot when you go to like chemotherapy unit or infection units, okay? You multiply the percentage of neutrophil by the total number of white BCs, then you get what we call absolute neutrophil count, صح؟ القيمة المطلقة للنيوتروفيل. لازم ما يكون تحت 1500 أو حتى تحت 500. If they are less than 500, this patient might suffer of what we call febrile neutropenia. Due to lack of a neutrophil or low number of a neutrophil, he might or she might develop what we call infection, severe infection. واضح? Okay. Chemotherapy in general, they suppress the white BCs, the RBCs, etc. You know that it has hematological adverse effect in such significant way. وبالتالي هاي الأدوية الكيماوية بالعادة يوم يعطوها ممكن تضعف المناعة وتضرب الخلايا صح؟ اوكي ممكن ينزل مستوى خلايا الدم البيضاء في الجسم and this lead to what we call neutropenia. طبعا neutrophil هون normal ranges guys. The function of each one of them, abnormalities when it does happen, bacterial infection, fungal infection, physiological stress, etc. 1, 2, 3, 4. Okay, so we have plenty of differential diagnosis for any abnormalities among these white BCs. ESR and C-reactive protein, we talked about the ESR, erythrocyte segmentation rate. The C-reactive protein is non-specific inflammatory marker. Again, non-specific inflammatory marker, but if you go hospital and you are suffering of infection sign, they will measure it for you. Sometimes, depending on the value, the physician can tell whether this is viral or bacterial infection. طيب سامحونا على التليفون ماشي مسموح كل واحد يرن اليوم. طيب anyway بس ما ننسى التليفون خلينا نعمله silent أو just make it silent guys عشان في شاحنة هون. لا وضع المحاضرة عن جد حلو. طيب ينقلون على البي 1. طيب C-reactive protein again, it might be elevated during what? Infection or any kind of inflammation. صح? Infection means inflammation because you have a war inside your body between the bacteria itself, the pathogen, and what? The immune system. And we have collateral damage. Collateral damage, fever, okay, inflammation. صح؟ طيب. Procalcitonin, it could be used as an inflammatory marker as well. Okay, and they found that it will be produced in response to bacterial infection. طيب, gram staining, سامعين, of course you heard about gram positive, gram negative, صح? Based on the gram staining. مظبوط? Gram positive, gram negative. We have gram positive bacilli or cocci, صح? Diplococci. صبية, are you okay? If you want to leave, you can leave. You look يعني little bit tired, exhausted. شو بتناموش يا جماعة ولا شو بتصيركم؟ بعدكم على توقيت ايش؟ على توقيت فيينا؟ طيب. يعني أنا شايفك مش مرتاحة بالتالي قلت لي إذا if you can leave. طيب. anyway. يعني أي حدا بيشعر إنه تعبان يعني ممكن يطلع من المحاضرة ما عندي أي مشكلة ماشي؟ صحتكم أولى يعني. أكيد. بعدين we talk about infection يعني اليوم بتروحوا حلقة بوجهني مش عارف I have some ear pain مش عارف بتبلش تتوسوس اليوم. Okay. Gram stain determine morphological characteristics. Of course you have heard about that in the microbiology course. تعرفوا الجرام stain, gram positive, gram negative. MIC breakpoint, what do you mean by MIC? Minimum inhibitory concentration. What does that mean? The lowest concentration of antimicrobial that inhibit visible bacterial growth after approximately 24 hours. Okay? As simple as that. The breakpoint, what does that mean? The concentration of antimicrobial that can be achieved in a serum after a standard dose of the antimicrobial. How we can relate these two terms together to each other of one? If the MIC, for example, is higher than the breakpoint, okay, what does that mean? يعني the concentration you need to kill the bacteria is higher than the level, the actual level of the drug inside your body after 24 hours. What does that mean? Huh? معناته the more MIC, the more resistance you will face. Okay? معناته MIC, if the number is high, that means the resistant or the bacteria is really highly resistant. واضح? MIC less or lower, that means we have sensitivity. That means this antibiotic can kill actually or stop the growth of such bacteria. لأنه antibiotic we have either bactericidal, صح? Or bacteriostatic. Bactericidal, it will kill the bacteria. Bacteriostatic, it will inhibit the growth of such bacteria. Then the immune system will continue the job. واضح؟ واحد ممكن يقول لي طيب وقفت نمو أضلت. لا. The immune system will continue. As you can see here, in this slide, we have cocci, bacilli. Do you have lecture after this lecture?
Yes.
Okay. وين؟ هون؟
بس في نص ساعة بريك.
ها؟ في 10 دقائق بريك. على الساعة بدك نص ساعة؟ قديش؟ لا. قصدي يعني okay, you can leave. I give like in general 50 minutes total, okay? يعني 10 دقائق بريك in between. طيب. بس في عندكم نص ساعة زميلتكم حكت يعني أنا استغلها صح؟ لأنه هسه أنت ورطت معاهم كثير. اللي بيجي في زميلتكم اليوم قولي لي بس لأنه أنا عارف إنهم حيبلشوا ليش تقولي له ماشي. طيب يا شباب يا صباح في كوكاي باسيلاي طبعا I need you to know each one of them لأنه هذا بيسهل علينا بكرة later on. بنقول هذا السيفالوسبورين actually it works on the gram positive. Not only gram negative. So once you know the positive, okay, you can tell, for example, it can work on Staphylococcus, for example, or Clostridium. this is work on spore forming gram-positive. You know the spore forming, for example, like Bacillus or Clostridium, as I mentioned, difficile. It works on only negative bacteria. We have Cocci, Bacilli again, Neisseria هاي مرض النيسيريا اللي هو مننجايتس بتعمل وحتى ممكن تعمل جونوريا. Okay, هاي negative. Okay, for example, antibiotic it works only on positive. It's not gonna help that much, or it will not help at all. Okay, you need to know. طبعا هذا التيبل. مع الوقت حتحفظوه. With time, you will memorize everything. Okay. The treatment of infection دائما بقول لك اشرب مي صح؟ If UTI, please get more water صح؟ Okay, flushing, better flushing of the system. By the way, الurine والblood والCSF in general they should be sterile. They should be sterile. يعني ما في bacterial infection فيهم. If you have bacteria, that means they are not sterile. Okay, but actually they should be sterile. The blood, okay, CSF, even though اليورين sometimes. ماشي؟ اليورين يعني إذا واحد فحصت اليورين ولقوا عندي بكتيريا طبيعي؟ مش طبيعي. It should be absent. If you are 100% normal, it should be absent. واضح؟ Ventilatory support, ventilation could help an infection as well as could lead to an infection. That we will hear about this term we call ventilator associated pneumonia for example. صح؟ اللي هي التنفس الصناعي. كثير ناس ماتوا من التنفس الصناعي because it's actually خلينا نقول invasive technique. يعني they put the ventilator inside the trachea. They should insert it deep, okay, as well as it could get colonized with such types of bacteria. وين طلع بالأخير هذا؟ هذا هو هون. هذا بده هو supportive medication أكيد اللي هي antibiotics as well as other required solution. For example, you have to keep the hydration by the way during the infection. لأنه if you have developed diarrhea, you might get dehydrated. Okay. في عندنا antimicrobial consideration in selecting therapy. أشياء drug specific, patient specific. What do you mean by each? Drug specific, for example, whether this is broad spectrum or narrow spectrum antibiotic. Okay, this is something related to the drug itself. It dosing, high dose, low dose. Some medications they are dose dependent, and other antibiotic actually we call them time dependent. صح? And we will see the difference. Patient specific, طبعا anatomical site where the infection exists. Okay. Drug allergy history مهم. This is patient related. If you are allergic to penicillin, you cannot use penicillin. يعني if you develop or you're known to have severe allergy due to use of penicillin, you should not give or try penicillin. صح? You might get anaphylactic shock and die. Concomitant medication الأدوية اللي باخذها لأنه في we have what we call drug interaction. Okay. Renal and hepatic function because the excretion and metabolism sites. Okay, this will determine whether to give such antibiotic or not to give. صح? Why compliance potential? Compliance, يعني if the physician prescribe you antibiotic for 7 days, you should take it for 7 days. Don't take it for 2 days. Oh, I feel good. Just leave it. Then the next time you develop the same bacteria, it might be more resistance. ولا لا؟ طيب. Empirical therapy should be based on patient and antimicrobial specific factor. Once you know what type of bacteria you have and you get the sensitivity test, okay, you can move or shift to more narrow spectrum. يعني it's only single agent. But in general, physician, if they are suspecting like severe infection, they give empirical therapy. Okay, they will take the blood sample, for example, or urine sample, etc. For خلينا نقول الزراعة. Okay, and later on do a susceptibility test. They don't do it in general that much. Okay, for example, amoxicillin actually still sensitive for such bacteria. They will shift to more خلينا نقول narrow spectrum or single agent. واضح؟ طيب نكون عندكم كمان نص ساعة بريك we have collateral damage as we mentioned earlier اللي هي السي ديفيسيت. طبعا شو ضل عندنا؟ السيبروفلوكساسين لاحظوا الدوزنج يختلف. It is totally different based on the treated disease itself. Uncomplicated UTI, different from complicated, severe complicated pneumonia. The dose of the same drug is actually different, even the duration. ماشي؟ طبعا شو ضل عندنا سلايدات؟ 26. طيب. بس طيب الباقي slide 26 the slide for the till the end of this slides يعني collection ان شاء الله I will record it يعني اوكي حيكون مكتوب بطريقه واضحه more details okay next week ان شاء الله next week we will start talking about the upper respiratory tract infection such as otitis media even we will cover some flu etc. يعني حتى viral infection we can cover it. And later we cover pneumonia or lower respiratory tract infection. هاي حتكون مادة الفيرست exam. واضح؟ First exam they should the schedule is not released yet صح؟ برنامج؟ not yet. They're supposed to يعني do it as soon as possible because ها؟ antimicrobial المقدمة هاي introduction الupper respiratory tract infection اللور اوكي يعني 3 topics الكتاب هو المرجع الاساسي by the way the book the textbook is the main source okay but ان شاء الله
درسنا السلايدات يعني كم بغطي بالنسبه
هاي السؤال هذا $1 million question thank you بس يعني لاحظي شوفي انا لو عامل السلايدات انا شخصيا بعرف احكي لك 100% ماشي بس to be in the safe side لانه الامتحان مشترك you will have like common exam okay shared exam okay just focus on the textbook والslide it will help you it will guide you by the way it will can cover up to 70% 78
دكتور خلص ايش رايك تعيد عدل على السلايد وتخلصي
خلينا نشوف بالاسابيع الجايه هو انا من اول ما داومت انا ما عطلتش طيب انت عطلت في ما خلصتي وين كان بالمالديف تفضلوا الدوز انا بالعاده بطلبها بحكي لكم شو المطلوب وشو المطلوب بس انا بحب يعني انت خلص دخلت مرحله الثيرابيوتكس يو نيد تو نو ايوه اللي بالسلايد ميدي كمان زي ما حكيت لك يعطيكم العافيه عشان ما اخرتوش عن بريكم نشوفكم ان شاء الله الاثنين القادم الاثنين القادم في حدا معي اليوم اندوكراين؟ وين هو؟